All right. All right. Hello, everybody. My name is Ira Kirschenbaum. Hold on one second. Speak of you. Yep, got it. We're admitting a couple more people into tonight's session. We have 14 coming on board. Should hopefully get to about 20. Yep, another one coming on board. I want to mention that I'm very pleased to have two of the authors here tonight, Omar Rahman and Kush Modi. Both of them were big contributors to this, what I think is very important article. I will share my screen just to really show this article. Hold on. This is not it, but this is the article. This is the article. Is a primer on non-clinical opportunities for the innovative orthopedic surgeon, which I think is remarkable. This is really something that people should hold on to. I think they should print it out if you still have a printer. Keep it on a PDF. There's a variety of opportunities. This was written in a beautiful manner. Why to do it, how to do it, and what are you going to do about it? We're pleased to have as our sponsor tonight a nationally recognized surgical consulting firm, Surgical Directions, and I invite them here. So thank you very much for being our sponsor this evening. So I am going to get rid of the share for a second and talk to Omar first. I know Kush is on here as well. Kush Modi, right? I'll ask you to unmute there, Kush. There you
Hi,
go.
Dr. Kirschenbaum.
How are you? Yes.
Doing great. How are you doing?
All right. So let me ask you a question, you guys. Let me start with Omar. Why is there a need for non-clinical opportunities for orthopedic surgeons? I mean, I spent 30 years doing surgery. You know, it's fine. I also did some other things on the side, but so I'm maybe not your average guy. So what do you think? Let's start with Omar and let's go to Kush.
Sure. I think it differs for every person. You know, some people are okay with the status quo. As an orthopedic surgeon, you've kind of gotten to the point where, you know, you're at the end part of all that training, undergrad, pre-med, medical school, residency, fellowship, and you're finally doing what you want to do. And a lot of people are happy with that. A lot of people are doing joint replacement, spine surgery, and within their niche, they're working on something still. So if you're in spine surgery, you may be working with an implant company or learning how to use, robotics or navigation. So it depends on, if you have a yearning to do more. And I like saying it like being a doctor plus or a surgeon plus. And if you have interests outside, and if you can marry that with your first career choice. So to me, it's almost, I'm a young guy, but it's to keep young and to always be thinking and always be learning. We're in a profession where we're constantly trying to learn things. And even when we're in attending, it's important to have continuing medical education to make sure that you're relevant and keeping up to date. So I think it keeps me relevant. And it makes my side passions a part of my true passion of being an orthopedic surgeon. So that's my short answer. But I think it varies for each person based on their own personal and professional interests.
Kush, what do you think?
Yeah.
Why?
So
Yeah.
yeah, first and foremost, definitely agree with Omar. I think it's based on the person and what they want to do and what they hope to gain out of it. But I think for me, thinking about it, I think Omar hit the nail on the head when he said that, just being a lifelong learner, because I think that right now we see a lot of physicians, whether or not, you can use different terminologies for it, but like burnout and, people kind of getting into a rut as they continue to go through the system and getting frustrated with the system. And what I've noticed is that the people who have a lot of interests, who are able to kind of adapt and be flexible and enjoy other aspects of their lives outside of orthopedics are the ones who actually are the happiest with their orthopedic career. And I'm still very early on, so I could be totally off about that, but that's kind of what I've noticed anecdotally. And so, I think that it is important to have other interests. And, if you're going to have other interests, then finding ways to capitalize on them in an economic way is also always a nice add-on. So, writing the paper was really interesting because it allowed us to explore all of these different opportunities and just kind of, essentially start the conversation around some of the other things that can be done.
Right. Oh, we got Dr. Selin Parekh coming on board. So we'll wait a second for Selin to be on. Dr. Parekh. Well, not yet, not audio yet, but he's getting there.
Yeah, I would love to hear Dr. Park's perspective. We were instrumental in writing the paper, but he talks the talk and walks the walk when it comes to these things. So would love to understand, from him as well, what motivates him to do that and how he balances everything.
I think you're there, Selin.
Hey, Ira, how are you?
I'm good. I heard you had an add-on. I didn't think there were add-ons in foot and ankle.
No, I was away out of the country till late last night. So we got a bunch of things going on.
Say no more. Say no more. Yeah, I got it.
Sorry, I'm late. I'm on for a little bit, then I got to jump back off.
No, it's all good. So let me ask you a question. What is the why for an orthopedic surgeon to begin their career and to get involved in non-orthopedic ventures? What is the why to you?
I think it depends on the personality. And for somebody like me, the why was I was just curious about challenges we were having in the clinic and in the operating room, challenges where I was frustrated with whether it was efficiencies, whether it was stages of a case, instruments to facilitate exposures, or a solution I was trying to do in the operating room. Mm-hmm. And then using those areas of frustration as focus areas for innovation, right? And those curiosities leading to innovation.
Yeah, I really agree with you that I think the first phase of an orthopedic surgeon's innovation career is usually just about 6 degrees of separation from their frustration in the OR, right? Then you call up Inomed or some other company and say, I have a retractor I want you to make,
Right.
And they make that retractor and they call it the Cush Modi retractor. And all of a sudden you see your name there and it's all goes on fire after that, huh?
Yeah, I think that's what it is. And I think once you get the bug for entrepreneurship or innovation, it's hard to let it go. For me, I was lucky that in medical school, I was surrounded by surgeon inventors. Oh. So I got to see it firsthand as a medical student and see the pleasure and joy you got out of having an idea, putting it on paper, and then having it out to helping patients with their issues. And it just really resonated with me. So for me, I was just fortunate enough to get exposed to it early. And what I try to do with my trainees is get them exposed to it early because, like I said, I think once you get bitten, you just keep going down that path.
Yeah, I think that I remember doing a project for the Academy on multimedia. It was the first multimedia CD-ROM called Orthopedic Grand Rounds. And I was working with Bernie Morey, of course, the great surgeon from the Mayo Clinic. And he was talking to me for about 45 minutes over lunch. And then finally he turned to me and said, I didn't even know you were an orthopedic surgeon. So I wasn't sure if that was actually a compliment to my entrepreneurship or he knew something about my operating that I was not aware of.
I think it was a compliment to your entrepreneurship, right?
Yeah, I hope so. I hope so. So yeah. What are some of the easy categories that surgeons can branch off into? I know everyone's busy early in their career. They want to build a big practice. They want to do this. They want to be the person. But what are some of the big categories of opportunity, do we think?
I actually think it starts really basic and at home. I think it begins with living within your means, saving so that you can set aside what you need for your everyday living and then have disposable income that you can then use to do entrepreneurial things, whether it's investing and doing private equity, or whether it's investing in real estate or investing in the stock market. I think that's really low hanging fruit, right? I mean, you don't need to know how to innovate. You don't need to have contacts in the industry. You don't need to know how to do a provisional patent, things like that. I think, to me, that's the basics. And then if you're interested in more than that, I think, again, you start, whether you're in academics or private academics, you have the opportunity to innovate on a daily basis. Look for your frustration points, because that's where there are solutions to be had.
Yeah, what do you guys think, Omar? Let me start with you.
Yeah, I would agree with that. I think it's important to understand that it starts as a side hustle, so it shouldn't affect, your everyday living. So, just a quick example, I'm sitting at home for 10 hours now studying for my boards, but I'm also looking at the stock market and looking at put options, and that's just like my own side interest, but that's something that I can do, on top of my more important tasks of studying for my board. So I would agree. I think it starts at home and making sure, you have money saved up so it's not going to affect your regular life. And then you can always branch in from there. You can always add more and, start small and add more.
So you mean I shouldn't have set up my kids for adoption when I started my first startup? Is that what you're saying?
That's right.
That's right.
Depends on your kids.
Yeah, note to self. When I do my life again, I'll do it. What do you think, Kush? You're the youngest of us all.
Yeah, I totally agree with what has been said. Of course, learning more and more from Omar and Dr. Park every single day, I feel like. But as far as I think they hit the nail on the head. It has to be something that you're interested in, right? So it has to be something that you are happy to do in your quote unquote free time. So you still have to, in my opinion, you still have to do everything that you have to do for your career. And this is kind of the work you do at home. As a lot of these things start as hobbies, right? You're not going to necessarily make money off of them on day one. A lot of times it starts as a hobby, and then you build it, and then it's exciting and you learn more in your in your free time. It's the podcast during your commutes. It's the audiobooks during the commutes, like all of those things. It kind of the way I imagine people get obsessive about learning orthopedics when they're in training. You kind of have to get obsessive about it as a hobby and nurture it and develop it over time. So for me, that's investing. I've been investing for years and really enjoy that. Whether it's real estate or some more venture capital type stuff, but it has to be something that you enjoy. I think that's first and foremost.
A lot of orthopedic surgeons like to make an implant better or make a procedure better. So let's start with Ceiling. How does a orthopedic surgeon at any age really get started in saying, I want to make this implant better? What are some of the methods they can use to get into that game?
So I think multiple ways, right? I mean, the first thing is to always, in my opinion, sketch your idea down, right? So that way, and date it and sign it and take a picture of it, email it to yourself so that it is basically time-stamped, right? And then I would not share. So once you do that, then you have to decide what way you want to bring this to quote unquote market. And you can do that either by teaming up with industry and sharing your ideas with different companies who may have technologies that you can leverage to make that product better. You can, if it's a big enough iteration where you think there's intellectual property around it, then you can do a provisional patent on your own. I usually recommend using an IP lawyer, an intellectual property lawyer, so that your provisional patent actually is done properly versus doing it through something like LegalZoom and trying to do it all on your own. And then you don't do it right, and then you don't get the protection. And then the third thing is, if it's really a change in the prosthesis, a dramatic change where you think you may be able to build a company out of it. Then that's the third way. The easiest way and the lowest risk is number one, which is, sharing the idea with industry.
Right.
And I'd also recommend strongly that the standard operating procedure is always to sign a non-disclosure prior to sharing your idea and your artwork. You may hear from some companies that, you share it with us first, and then if we decide we like it, then we sign a non-disclosure, but then the cat's out of the bag and it's too late. So that's an important mistake not to make.
Yeah, I couldn't agree more. I'm actually going to share my screen on something. This is on Google Patents. These are 3 patents that I have. And they started as provisional patents, and all of them were ideas that something needed to get done. This one, short use system for a method to protect. Essentially, it is a 2-ply pair of underwear that in the space you can put a V-shaped X-ray protective lead, so you can take an X-ray of a pelvis of a kid and really protect them, but still get the hips. And no one did that. So I thought of that. We adjusted the expiration, originally 2006, and kind of creepy pictures, actually, personally. I think they are, but it shows you, it protects the kid. And the way this happened was that I had a patient who, the child had a congenital problem of the knee, and I had to keep on getting long x-rays. And she said, is there any way you could develop something to protect this? So I bought some Tyvek and I cut it out myself, and I made the original thing basically in my basement, as you said. And then I got a lawyer and I got a provisional patent. A provisional patent means you're protected for about 18 months, if I'm correct on that. And, the rest, we end up selling it to a bigger company. But getting the patent was all because I needed it in my practice. And I made it for this one kid, because every 3 months this kid had to come in, and the mom was concerned that we couldn't protect just a selected part of the body. So sometimes, you need to do something and you think of it. And I always tell young surgeons, if you could think of it, you can do it yourself.
Yep.
Don't talk to the rep over dinner and say, I got a good idea for you guys.
Right. No, right? For sure.
Yeah.
No, you're absolutely right. And in today's day and age, compared to 20 years ago when I first started, with accessibility of the internet, it's so easy to be able to, even if you wanted to, you could even make the CAD drawings yourself, right? I mean, it's all easy to do compared to 20 years ago. And so, and again, it just goes back to, you just have to be attuned to listening to what's happening around you and being attuned to what's happening for you to see where are the bottlenecks, the frustrations, and there's solutions to be had there. It's just a matter of putting your mind to it and spending a little time ideating.
Right. Kush, what do you think? What is that? How does that inform you going further in your career?
Yeah, I mean, I think first and foremost, if like what you mentioned, if you have an idea, kind of building that out first and seeing if you can do it on your own is obviously very important, just so you can maintain the intellectual property associated with that. But it's exciting for me, like I'm at the very, very beginning of my career at this point. And
me too. I got to.
And no, it's fun. I mean, orthopedics is one of the most innovative fields out there, and that's what drew me to the field. One of the many reasons that drew me to the field. And so I'm just excited to, as I notice inefficiencies, they're all around us in healthcare, whether it's a device that can fix it or some sort of operational inefficiency. It's always fun to kind of think about ways to fix problems. So I'm just excited to kind of get started doing some of that and noticing some of the things around me. My clinical knowledge is not quite there yet to see things right now, but as I build that, it'll be fun to kind of also just keep my eyes open and try to notice things around me and how, they could potentially be improved. So it's very exciting.
Great.
Well, I'm
Yeah.
gonna give you a theory of mine that's a little bit blasphemous, but I think there's merit in it for the innovator. One of the things, Kush, you'll find as you go through residency is everyone's gonna want you to know the literature. But what I will tell you is don't be a slave to the literature. Know it, but don't be a slave to it. And what I mean is don't just drink the gospel just because it's in the paper. And then that's just the way it is because that's what was written in the paper and that's what they found. Use that as a foundation of knowledge to think about things and come up with your own ideas. And those ideas may be totally different than what's written in the literature, and that's okay. That doesn't mean it's wrong. It may just mean that it's never been explored before. So I think that's an important thing. I value literature because I think it provides foundational knowledge, but I don't think it is always the guiding principles.
I think I'll tell you guys an anecdote. One of the first startups I did was an online orthopedic interface called Bone Home, which was started in 1994. And I presented this idea that we can do medical education, 1992 to 94, to the board of the AMA. And George Lumberg, the editor of JAMA, actually said at the meeting, nobody will ever want to communicate or do education on this medium called the World Wide Web. Okay. And I ended up selling that company to a group of private investors and it became Medscape. So I was one of the 12 founders of Medscape Orthopaedics. And we hired George as the editor a couple of years later. And when I saw him in the halls, he said, "Don't even come near me. I remember you." Yeah. So if you stay too close to convention, as Dr. Perrick says, you get caught in the way of doing it, one way or another. Yeah. Unless, Omar, of course, you're in sports, then every other week it's a different technique. Is that correct?
That's right. It's all magic, remember? Yeah,
sports magic. Sports magic. A lot of innovations happen in sports. Companies pop up all the time, and we have BioRes come up with as a company with a single product. You have MIAC, the bear implant with a single product. What is your feeling when you see these single product innovations as a sports person?
Yeah, I think it's interesting. It's funny. I didn't mention this to you, but I was down at Arthrex for a month for my elective, and it was something that I did on my own to learn more about the innovative side of medical industry. And basically, my job there was just kind of do a little bit deep dive from the orthopedics perspective of these different companies. And I was looking at them, and it's interesting because I think it all goes back to when you look at these companies, try to treat it as if it's like a startup. So like, really understanding the problem. Like, is this just like some new high-tech thing that's out there that's following the trend of biologics and stem cells and regeneration? Or does it actually have any value? And looking into BioRes and some of the other companies that are out there that are kind of trying to make these more biologic friendly suture or patches. It's important to just look at the literature to see what's out there right now. Has it been done in the past? Why, if it did work in the past, or if it was invented in the past, why it didn't, catch on the trend? So I think it's important to look at your history and appreciate it, and look at the literature and appreciate it, and see exactly what problem they're trying to solve, and then actually trying to figure out how big that problem is. If there is a company that's making personalized HTO implants, how big is that market? And if it sounds great, and if it makes the life of a surgeon easier to make an osteotomy and you don't have to worry about the neurovascular structures as much, is it worth investing in from a market size perspective? So I think you kind of have to look at these companies from all sides and not just be tunnel vision into thinking it's cool and new, but actually think if it's actually going to benefit your patients and if there's actually value in it financially.
I'd like to pivot for a second while Selim's on and not get into the OR. One of the biggest problems we have in healthcare is not a new double row anchor or not a new, customized joint replacement, but healthcare itself, the process of healthcare, value-based healthcare, costs in the OR, costs of healthcare. I see a lot of opportunities for orthopedic surgeons to pivot in that area. What do you guys think about that as an opportunity to consult in or to be part of? What do you think, Selm?
I mean, I think you're absolutely right. Again, that's a challenge to the health system, but it has specific parts that are really important to the orthopedic surgeon. So, for example, value-based healthcare, it may not be sexy and trendy, but it's certainly very important. And it's basically where the future of healthcare is going. So, again, it depends on the personality of the surgeon.
Yeah.
There are guys who love to innovate in the operational side. There's guys who like to innovate in a public health sector. Somebody like me likes to be more in the devices. I think it really depends on your personality, but you're exactly right. There is innovation opportunities all over. And, it even goes into apps and software and the hardware side of things. I mean, so you just have to pick where you're passionate about, and there's opportunities around.
All right, as a promise to my sponsors tonight, I'm going to, for exactly 3 minutes, we're going to ask surgical directions, Leslie Basham and Greg, to tell us about what they do. I think they are a extraordinarily innovative consulting company. So I'm going to pass the screen over to you guys. Go right ahead.
Thank you, Dr. Kirschenbaum. I'm Greg Regani. I'm a client executive. I'm hoping you guys, can you see my screen okay?
Yeah.
Yeah.
Okay. Let's see if I can make this work. All right. Better?
Better now.
All right. So thank you for having us. We're proud to sponsor JOEI, the journal tonight, and appreciative of the opportunity. So with me is Leslie Basham, our CEO, and just a quick overview of what Surgical Directions does. We are a healthcare consulting company that focuses on the perioperative space. So what we do on a regular basis, hopefully let's see if it's moving. Sorry about this. And I have technical difficulties.
It is moving. It's just not on the.
Right. It's on the second slide.
Yeah.
Yep, absolutely.
Perfect. So just an overview, in America, the OR still drives revenue in the hospital. And what we found, both pre and post COVID, but mostly post COVID, is that's all under attack. There's been about a 15% drop in revenue in the hospitals. A lot of that's due to reactionary nature coming out of COVID. A lot of it's just trying to get surgical back, operations and procedures back into the OR, whether that's in ASCs or in the hospitals. And it's been a struggle. So we work as an optimization company to go in and evaluate and work through those struggles that are going on. Our history over the course of time, we've worked in over 400 hospitals, ASCs, physician practices in different areas of healthcare to work on optimization and efficiencies. Over 35 years of experience. We were founded by physicians, anesthesiologists, and business associates that grew this company and took over, became a sole owner of the company last year, as a matter of fact, from Mednax, which was started as a pediatrics company. Normally, when we get engaged in something, we can find up to 10 times of a return on the investment when we do an engagement. So we've had a great success, and I'm going to pass this over to Leslie to talk a little more about what we do in the OR.
So we have 3 core offerings, and relevant for this group, right, is helping to make, through procedural consulting or anesthesiology consulting, help to improve surgeon access and the patient engagement. So we do a lot of block scheduling, block redesign, service line strategy to help improve the productivity and the schedule balance between your clinic and OR time to make that all run better, less friction points, and create a better governed health system and hospital for surgeon access and patient care. We also offer interim leadership, So we'll place OR direct senior level. So OR directors from a nursing perspective, chiefs of anesthesia. We have not placed ever a chief of surgery. That's a different model, but a lot in the anesthesiology space. And then based on some of the discussions we had today, there's so much innovation and technology in these one-off point solutions. So we've created an OR scheduling and efficiency software called Merlin that we use to track patient throughput and OR efficiency and financial impact, so that all the changes that we're making, the surgeons and OR leadership have access to that information and can manipulate the data so that they better understand turnover time or block scheduling or utilization. So what makes us different? We are a very high-end consulting firm, Ira. So thank you for that intro. It's expert-led. It is driven by, there's a physician on every team, either an anesthesiologist or a surgeon, an OR director, a strategist, and a data scientist. And so that allows us to have these peer-to-peer implementations across the 400 hospitals, very results-oriented and analytics powered, right? Because if you don't have the data, and Ira and I have talked about this a lot, if you don't have data you can trust and to drive decision-making, it's going to be very hard to get surgeons and clinical staff to change the way that they're driving particular outcomes. So thank you very much for having us. This is an incredible topic and right on point, because it is. So I encourage, as I loved the innovation talk, because how can we also take that into our own ORs and from operational perspective as well, and innovate to improve the way that care is delivered today. There's plenty of opportunity. Thank you for having us, Ira.
Thank you, Leslie. I really appreciate it. I appreciate the support, but I also very much appreciate companies like yourselves who are in this space, because I always feel, and this is something for everyone online, we often talk about, there's device innovation, but there's also process innovation. And process innovation is extremely important, because I think that's where there's a tremendous amount of low-hanging fruit in the area of process innovation, because that's where, in healthcare specifically, I'm talking about. I'm not talking about in Toyota. They've kind of figured out efficiency at Toyota pretty well. That's why they call it the Toyota way. But in healthcare, there's so much low-hanging fruit for innovation to make a change. I mean, I'm gonna ask anyone in the audience if they know any anecdotes of their own place that there was process innovation, something in the OR, maybe something as simple as an anesthesia induction room, which has been done elsewhere, is not new, but sometimes innovation in your place may be something that is taken from somewhere else. So process innovation is a very strong part of what I think we're talking about by opportunities. And there are opportunities for surgeons to consult in this area. There's opportunities for surgeons to start companies in this area, not competitors. Sorry, Leslie. It's all right.
We're always hiring.
Yeah. The Kirschenbaum Raman Modi Company will soon take over and something like that. So let me ask Omar, how, if somebody really wanted to change, let's say, something at Arthrex, how did Arthrex tell you they go about doing that?
How would Arthrex tell me to do that?
Yeah, like if you had an idea for Arthrex, how do you, they have a lot of products, a very innovative company. But now you want to modify one of their products, right? And you did a rotation with them, right? You said?
Mm-hmm.
So did they give you an idea of what to do if you think you want to change their swivel lock or whatever they're called?
Yeah, I would have to convince Reinhold, which would be probably the hardest job in the world to do.
Right.
But no, I think to that point, I'm not at that level yet with that company, but I think you would have to be very involved with in their product development and be one of their true champions of knowing the product in and out and what actually works and what doesn't work. So it goes back to experience with that implant. So I think you need to use it a lot and truly understand what doesn't work with it. And in that case, if you're trying to make a modification, I think that I wouldn't really call that innovation. I think that would just kind of be a modification of whatever implant they have. But I think that's where you'd go from. They have their surgeon champions, and I think the most important part of any company, including Arthrex, is it's got to be surgeon driven or customer driven. So who's using your product? It's not actually the patient; it's the surgeon that's using it. It's got to be safe for the patient, but the one who's using it is that's where the innovation is gonna come from.
I also want to point out, if anyone has any questions, you can speak up or just put it on the chat. Any question at all at any level. I always felt that there was 3 areas when you come up with an idea that are important. One is you need the idea. No shortage of ideas. No shortage of ideas in the world. You need the ability to make it. So if you have a new idea for a new swivel lock, you're not exactly making that in your basement, right?
Right.
You know, that's why I've always cheated on software development, because I could do that in my basement, you know? And the third part is you need a distribution mechanism, right? And people have to understand that, those 3 things. Kush, what do you think about that as a guideline and a model going forward to understand that?
Yeah, absolutely. I mean, I agree with you. I mean, software is great because it doesn't require a lot of actual equipment. But from a hardware perspective, I mean, I've never developed an implant or anything like that, where I am in my career, but it makes a lot of sense that, you there's a lot of moving pieces involved with doing some of that work. But, I think the most important part of it is just really, I imagine it's just thinking it through, right? So I haven't developed an implant, but I would say from the medtech VC work that I do, the people that I've seen that are successful early on are usually the ones who have really taken the time to iterate in their mind, and then iterate as much as they can, through various different devices or different products, and then kind of come, do some customer feedback and, just ask around other people, maybe friends or colleagues, what they think, and just try to really work out all of those potential issues up front. So I think that, obviously all of those things are important.
I'd like to double down a little bit on something Dr. Parrick said, and he had to go to the OR and he apologizes for having to leave early. One of the things I think all orthopedic innovators in orthopedics, or anyone who has an idea to make a change, you need to get your home base down first. The great many of the great orthopedic innovators were first great surgeons, good practices, well known. I think of Bill Harris at Mass General, developed the Harris hip. He didn't develop the Harris hip until he used the Charmley hip probably about 3,000 times, and getting your, in Omar's case, it really will help you a lot if you pass your boards this year, wouldn't it? To get to the next level, world domination follows passing your boards, right? Yeah,
that's right.
We have Jim Smith. Do you want to give the question yourself, James?
Good. Hey, sir. I spoke Saturday on the phone. I go by Dusty. I don't
know.
Oh,
Dusty. Yes, that's correct. I'm sorry.
I don't know how to change my name on the damn screen.
That may be an innovation as it is. Yeah.
Yeah, for me, it probably would be. One thing I'd like to say to the guys out there, the younger guys especially, I'm not quite considering myself an old man. I'm probably middle-aged in this. But one thing you can do if you are looking to get your voice heard a little more within whatever subspecialty you choose, is to get with some of the smaller companies and do some work with them. As I started out, I was trained at what's called the Leatherman Spine Institute in Louisville, Kentucky, which is solely a Medtronic place. And when I got out, there were some changes I wanted to make in some of my sets. And you're not going to change Medtronic's ideas because they're perfect. But you might change whoever small company's ideas, and they're going to be more open to listening to you. No, Medtronic's not going to change a set because of you, because they don't need you. But smaller companies who do, your voice might be a little louder in those smaller companies. It doesn't mean you're going to necessarily use everybody's products, solely. But if you're looking to make some changes, and the problem with as we come, I forget the first man who was talking a lot more. Biggest problem with, sir?
Dr. Pratt. Yeah.
Yes, sir. He very casually mentioned money. That's the biggest problem you run into when you start a company or you're going to go off on your own, is it's expensive. Even a patent, when you patent something, you're looking just from past experience at about $150,000 to get it from your drawing to a patent, using a patent attorney and all that. So those are not inexpensive endeavors, especially looking at, I see some gray hair around here, but there are some young guys too. At some point in your life, that will not be a lot of money, but at your point, it's a lot of money. So, if you're going to be an entrepreneur, you've got to start small. And at some point, you will be able to break off on your own and do your own thing.
Dusty, can I ask you a question? I know you're involved in a startup. So tell us about your startup.
My company is a spine company called Acura Spine. I got lucky and teamed up with a couple of young engineers right out of school, and we invented a fusion device for spine surgery where it's the only, I guess what you would say, fusion device where I can control the height and lordosis of my cage independently of each other. Right. And so but it took a lot of learning and doing things wrong to find that out. Right. So you're going to make a lot of mistakes before you do things correctly. And this, if you're getting anybody who's gone through this process, you're going to screw up a lot more than you do correctly. And don't get discouraged. It will come if your ideas are sound. But if you get discouraged by every time you mess up or make a mistake or something doesn't work, then you will get very frustrated in the process.
And you're still operating full time, of course, right?
Oh, absolutely. These are things like the younger guys said in the beginning. This is what you do on your free time. This is what you do when you wake up at 2:00 in the morning because you have an idea and you go sketch it down. Or you're thinking about something while you're running or whatever you're doing. You got to get your practice going. And like he said earlier, you got to make the money, because if you don't have the money, the company is going to get it, because you've got to rely on the company to give you money.
Right.
So it's all money. It's sadly enough, it all comes down to it. So if you really want to be an entrepreneur and have your own company, you've got to live very meagerly and save that money so that when it comes down to it, your CEO calls you and says, "Hey, I need $400,000 tomorrow." You can write that check. Right. And that's not an uncommon thing. Everybody who owns a company is laughing right now because it's happened to them. Right. And so those are all very, very wise words.
Yeah, it's really very important. I think you're absolutely right. I think one thing that has always driven me to do a variety of different things has been what is called by the millennial generation the FOMO problem, fear of missing out. You know, somehow when I get an idea in the operating room, when we came up with an idea when we were in the operating room of titanium guitar picks, even titanium guitar picks, because we were in the operating room and someone was talking about playing guitar and someone would say, this doesn't, and we literally actually made them and formed a company out of that. I have to say it was my least successful venture, but I do have to say it was like, let's do this before somebody else does, titanium guitar picks. So, because we work with titanium in orthopedics, and titanium was a cool product that the baseball players were wearing around their neck, so we thought it would be a cool idea. But cool ideas don't always mean financially successful ideas, do they, Dustin?
They do not. And like the man said in the beginning, don't tell anyone your ideas. That's the problem. I was one of the first people to start doing lateral lumbar fusions, and the instruments just weren't there. And so I made the mistake of explaining to the company I was working with what I wanted, and I actually bent my own instruments in my shop and made them and sent them to the company to make the degrees I wanted and all that kind of stuff. And it wasn't 3 months later where I was looking at somebody else's set, and I said, "Where did y'all get these instruments?"
Yeah.
And they go, "Oh, we saw them." I didn't patent anything. I didn't know any better. So
right.
if you come up with the smallest idea, write it on a piece of paper. That's all it takes to get a provisional patent. It doesn't take much more than that, and then follow it through. But it doesn't matter what it is. If you have a good idea, somebody's going to take it and run with it, and then you've lost it.
That's true. That's true. Let me ask Omar and Kush. Do you think there's any role for some formal education in entrepreneurship, business, new ideas in residency? You can forget medical school. Medical school is a useless time in your life, but residency. What do you guys think? You think if it was part of a curriculum of a forward-thinking residency? What do you guys think?
Yeah, I'll start with that. I will say 100,000%. We live in this black box of, these headphones aren't working anymore. Can you guys hear me still?
Yep.
We live in this black box of knowing everything in medicine, and then it becomes smaller in orthopedics. And then when you get out there, and I'm not even in practice yet, no one knows anything outside of orthopedics, and you kind of just learn it on the go. And right. my colleagues who are now, first and second year attendings, they're kind of learning how to run a business themselves and stocks and whatnot. So I think there's absolutely a role. And the whole reason this whole started, I think it was maybe 7 years ago, I cold called Dr. Parekh, and I asked him, I'm trying to be an orthopedic surgeon. I want to use my MBA. What do you think I should do? And I got advice from him. And I tried doing that in medical school, trying to have like a mini MBA program for medical students. Mm-hmm. And I'm doing the same thing at Lenox Hill. We're trying to get more finance topics going that's all relevant around orthopedics. And I think it's absolutely important, because these are things that are taught outside, or you kind of self-learn it after residency. And there is value in that. And when I went down to Arthrex, I talked to them afterwards as like kind of like my exit meeting. They asked me if there'd be more residents that'd be interested in a program like you did. And I was the guinea pig. I set it up myself. I met with the patent lawyers there. I met with the engineers, the product managers, and I said, absolutely. They're nationwide, worldwide. There are residents that are interested in these topics, but aren't formally taught it. So even if it's like a 1 week, 2 week, sprint or a boot camp, it's going to be super relevant, because, all the people that I've met all the other authors, it was all cold calls, and it was all, emails of, seeing that everyone was kind of talking about the same thing online, but we weren't exposed to it like in our everyday life or residency or school or whatnot. So I think it's absolutely important to have some kind of formal education in this, just so there's some kind of basis to work off of.
Kush?
Yeah, I mean, obviously, Omar and I are totally on the same page when it comes to this kind of stuff. And yeah, so when I was at Drexel, so for those of you who don't know me, I'm just starting my residency in orthopedics at Rutgers in Newark. Went to Drexel for med school. And when I was at Drexel, I actually built a personal finance course for the students because I think it's incredibly important. I also helped put together a medtech incubator while I was there. So what we did was we took people through the process of kind of having, a problem that been identified by some doctor or nurse or PT in their practice, and then trying to come up with a solution and building out an MVP or minimal viable product for that idea. And so we actually built together, put together teams of med students, engineers, and entrepreneurship students, and had them go through a whole process throughout the calendar year, and we built a course around that. So I think even at the med school level, there's things that people can do. Of course, that would have been a very general course, and doing something in residency, you can tailor it more to orthopedics, and it becomes even more, I guess, practical and less academic in nature. But yeah, I mean, absolutely, I think it's important. And I think that now starting residency soon, I think it's a challenge for us if we're interested in it. If it's not something that already exists, I mean, I think it has to come from the top in a way, because it's hard to necessarily just go in and say, like, I want to do all these other things. And Omar, I actually, if that's all right with Dr. Kirschenbaum, I actually have a question for you. We've talked about this before, but like, what's your advice for me, like starting residency, obviously have similar interests, would love to help, as you did, build a course at Rutgers, or find a way to do some of those things. Like, is that something that you think is well received by faculty at your institution, at most institutions? And what's the right way of going about that? Do you have to be a senior resident before they believe that you're focused enough on your clinical education and not distracted by other things? Or is that something that an intern or second year or something could potentially even work on? Just curious how you went about that.
Yeah, great question. It actually made me reflect. When I was an intern, we had a Friday conference that was canceled, and I had prepared a talk on how to read a balance statement, and I gave the lecture to my chief residents, and obviously they gave me crap afterwards for knowing something that they didn't. But I think it's all about breaking the hierarchy. And Lennox, so we have the privilege of being like such a small program. They're all friends and family, but you being an MBA, you have a skill set that some of the residents don't have, or some of the attendings don't have. And I think to answer your question, it's having those conversations either one-on-one or with groups of attendings or residents or fellows, and realizing organically that a lot of other people are interested in these topics. They just don't know who to talk to or what to talk about. Everyone has frustrations in the OR. Even PAs, even the circulator nurses, but no one likes to talk about it outside, or they just, they drink it off or work it out or something. So I think it's important to keep having these conversations, not just informally, but formally. And I think you need to find some kind of champion. So even when you're an intern, find an attending that can take you under his wing, and you guys can do it together. So I think having that structure and fundamental support in your program is going to be important to actually get it to go somewhere.
I think that's
Mr. Kirschenbaum, do you mind if I, from my perspective, throw a couple thoughts out?
Yeah, Marty, go ahead.
So I'm industry. I'm also a patent holder, so I've come up from a couple of other sides. And Kirsch, I think one of the things that you hit on has always been a passion of mine. I think there's a real opportunity for the doctors and people as the industry's moving to ambulatory surgery centers, and as doctors are moving to business. I would love to see somebody, and I've tried to challenge a few people to do it, is why not take an ASC and create a 50-50 fellowship where you not only teach surgeons how to do total joint arthroplasty, but teach them the business aspect of doing total joint arthroplasty at the same time. Make it kind of a mini MBA, so that when you get done with that fellowship training, not only do you know how to do the surgery, you know how to run the business around the surgery and stuff and make it a practice, and go back out and do it. And I will also say, Dr. Kirschbaum, I think you hit on something that was really key early on about the processes and procedures. One of the challenges we're facing today is, and I come from industry. If you guys want to go have a drink sometime, I can tell you why my knee is better. But the industry sees a knee as a knee, and there's not a lot of financial value in changing implants anymore. But one of the things the industry really lacks is take an EMR, for example. Look at how broke that EMRs are simply because physicians really didn't have good quality input into the tool that they're using. And most of these things like Epic and Cerner, they're a waste of most physicians' and patients' time. The only value to them is who's ever doing the billing out the other side. And I think there's a huge opportunity for doctors that want to get involved in the processes and the procedures and fine tune that and change medicine from that direction, because that's where the real future will be. You can only do so many $2,500 knees in a day.
Yeah, I think that is an amazing point, Marty. As frequently we've had this is our 7th or 8th journal club. You end us on a great note. I'd like to add, though, that it would be great to have industry as partner in that education. Very much like the Synthes company early on had the AO Foundation with the education in fractures that then fed the innovations of the company. So, maybe we'll one day see the Surgical Directions Institute, which will teach some surgeons things as well, which will then inform the company. So I think we need to see the hierarchy of medicine adopt these principles that Omar and Kush have talked about. I think we need to see industry adopt them. And I think, as always, I don't want to stay over time. So unless we have some last minute comments, I'm going to end it here. I want to thank Surgical Directions for their sponsorship and their support of JOEI. Thank you very much for that. And I want to thank Kush Modi, Omar Rahman, and Celine Parrott for amazing article. The article is on JOEI, beautifully done. And I think it's an article for the ages. It'll be around for a long time. So I'm going to end the meeting now. I want to thank everybody for coming on board, and have a great night.
Thank you.
Thank you.
Thank you.